Hello again, everyone, and welcome to today's episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels, and joining me on the podcast today is my friend and colleague, Teresa Holler, who is a physician's assistant and has worked for many years in the Lyme/slash tick-borne disease area, has a lot of experience using herbal medicine like myself. And I just appreciate that there are like-minded individuals out there that treat Lyme and these tick-borne illnesses in a very similar way. So, Teresa, welcome to the podcast.
I appreciate it. Thank you, Darin. It's always good to have a conversation with you.
So, let's talk a little bit about Lyme. One of the things that maybe doesn't get talked about enough is, we this idea of what we call pleomorphic, this ability of Lyme to change. Can you just tell people a little bit about this pleomorphic nature of Lyme and why that actually makes this bug a little bit more difficult to kill?
Sure. So Lida Matman was the physician who wrote the book about pleomorphism, and she was just a hero in the world of medicine because she realized that bacteria pass through different stages. And so we used to say, oh, it's a cocci or it's a rod, and we
Right.
realize now that they change shape. So Lyme is one of those organisms that does that. And the problem with that is that when it shifts shapes, it'll move to a form, like for instance a round body, and that round body, like for instance doxycycline, when it kills a spirochete, it actually moves them more into round bodies. And then when that shape comes out of its latency and becomes virulent again, or back into a spirochete that's an active form of Lyme, it's actually more virulent, and so it becomes more of a problem. So they're harder to kill, and they become more virulent when they come out of that phase.
Yeah, it's one of the few bacteria out there that's really a true shapeshifter. And we talk about this before with other people, and most bacteria they don't do that. Like I said, they're a rod or they're a cocci, they're a little round ball. But it's interesting when you look at these electron microscope images of Borrelia. Sometimes it's this long, uncorkscrew thing, kind of compared to a slinky. For those of you who are old enough to remember what the slinky is, and then yeah, sometimes it balls itself up in this little tight round ball, and then you can see this kind of thick film around it, this biofilm, and maybe we'll talk a little bit about biofilm as well. But this ability to adapt and change and get into cells, get into tissues, really makes it truly uniquely different than other, certainly bacteria that we have to deal with.
Yeah, and it also makes the antibiotics less effective because most of the antibiotics are going to be effective against that normal spirochete form. And so this round body is a persister, and then the stationary phase is a persister. And then, as you said, the biofilm is a persister. And so we need to use products that are going to address all these persister forms. And the antibiotics that are used, that are FDA approved, have been shown in clinical trials to not actually eradicate Lyme. They'll reduce it, but they won't eradicate it.
Yeah, you use the term persister. Can you help educate people who might not be familiar with that term, what a persister is?
Yeah, I think that's more of a lay term, that just means that it's hard to kill, so that makes the infection persist. And really what they're referring to are these forms I just mentioned that are hard to kill. And what's cool though is that we have clinical studies now with herbs comparing them with antibiotics showing eradication of these persisters. And a lot of these studies came out since 2020. So it's super exciting. We have these studies with Lyme, Borrelias. We have these with Bartonella. We have these with Babesia, with different authors in this world of Lyme and co-infection. So we do have more data to drive our choices of herbals now, which is exciting.
Yeah, Dr. Monica Embers at Tulane University has actually published quite a bit on these persister cells. And I think what's fascinating is that from the minute some people get bit by a tick, up to 20% of these Borrelia organisms are already resistant to antibiotics. So even if you catch it early, you do the appropriate, doxycycline for, 2 or 3 weeks, there's again about 20% of people who just don't respond well and end up with, what they call, post-Lyme treatment syndrome. We would call it chronic Lyme disease. But this idea that some of these bugs, again, are just hard to kill. And, can you talk a little bit about doxycycline as a whole? I kind of rail on doxy all the time because the mechanism of doxy versus other antibiotics. Can you share a little bit about why that's not a great option?
Well, first of all, we have clinical studies that show that doxycycline will double the round bodies. So it reduces the spirochetes so people feel better. The
Yeah.
problem is they're not actually eradicating the infection. And that study was interestingly done in comparison to two separate herbs. One study was against Cemento, which is the TOA-free cat's claw. So it's good for autoimmunity due to the TOA-free. It's an immune modulator, safe for everyone. It won't cause immune stimulation. And then it was done again with Banderol, which is a toba bark. And in both of those studies, the Cemento and the Banderol reduced both that active spirochete corkscrew form and that persistent round body form, whereas doxycycline that just doubled and made it worse in the long run. And the other thing about doxycycline is it's been shown to, if you use any antibiotic in a subclinical, subtherapeutic dose, it actually worsens biofilm. So with the herbs, we can improve biofilm. In fact, Cemento plus Banderol, when they're used together, reduce biofilm by 75% without even having to add a separate biofilm agent. So there's many reasons why I prefer the herbs to doxycycline. And then you mentioned Monica Ember's study with the form of Lyme being persistent early on. We have now found that there's even round bodies, this persister cell in the saliva of ticks. So immediately at impact, you have round bodies now, and we didn't used to have that. So I even in my own practice used to treat acute Lyme with doxycycline, but now we know it's already in a round body. It's already going to be resistant to doxycycline. So I prefer the herbals even for early treatment, maybe in conjunction with doxycycline, but certainly not by itself.
Yeah, and just a reminder that doxycycline is what's called a bacteriostatic antimicrobial. It's not bactericidal. It actually doesn't kill anything. All doxycycline does is it stops the organism from replicating, which, like you mentioned, only works when it's in its long form replication phase. When it goes
Yeah.
into that round body form, it's not replicating. So doxycycline's not going to do anything. And,
Yeah.
so we
Yeah.
drive it into a round body form. We don't kill it.
Well, now you're talking about the stationary phase, which is even worse. So,
Yeah.
like, we know that when bacteria come into the body, the first thing they do is start reproducing, and they try to reproduce and get a big mass of them in the body. And when they get that big mass, they stop reproducing and plateau, and that is called the stationary phase, which is what you're alluding to. And the problem with the stationary phase is nothing kills the stationary phase. Technically, bactericidal antibiotics should, right?
Yeah.
But when they did a clinical study comparing doxycycline, of course, did not, like you mentioned. The cephalosporins should have. They weren't very effective. Dapsone wasn't very effective on either form by itself, but the original Dapsone protocol, Dapsone, cephalosporin, and a penicillin type drug, right? I think it's the three of them.
Yeah.
Doxy, Dapsone, and a cephalosporin. That's what it was. The three of those did reduce that stationary phase, which is why it became popular. But the problem is it didn't eradicate it. And so the stevia, believe it or not, the NutraMedix brand stevia, compared to other brands of stevia, which did not work, but the NutraMedix brand stevia eradicated the stationary phase. There were no only dead cells. So there's nothing left to come back when you finish treatment and remove it. Whereas with the Dapsone protocol, it evolved to the double Dapsone, quadruple Dapsone, and now currently it's the quadruple Dapsone plus pulsing when you finish, because if there's something left, it's going to begin reproducing. So, like you said, the stationary phase is even tougher than the round body. And the only thing we know that can actually eradicate it is the NutraMedix Stevia, two dropperfuls twice a day for 2 months with whatever other herbs you're using.
Yeah. It's I think this has been kind of one of the big thorn in, Lyme disease aside, is again finding effective therapies, whether it's antibiotics or herbs that are going to address the stationary phase, the log phase when it's growing, again, when it's in its uncoiled form, its round body form, of being able to address all the different phases and kind of shapes. And I think this is where herbs probably really excel over antibiotics. And of course,
100% agree with you. And the clinical studies prove it. Yeah.
yeah, I mean, Dr. Eva Shoppy, I think that was the first study referring to at University of New Haven. I know she published a study, again, with Cemento and Banderol and compared it with doxycycline and rifampin. And again, found it addressed Lyme in its log form or log and stationary phases and was more effective than doxycycline or rifampin, which are, both very commonly used in the treatment of Lyme disease. So, you
Yeah.
know,
And it's interesting that even rifampin, which I always thought was more effective on persister cells than doxycycline, some of these other antibiotics, but I think it was the MA study that came out in 2021 for Bartonella showed that the rifampin didn't even eradicate the persister cells of Bartonella. So these antibiotics that we think are so strong, when the herbs are in comparison, the herbs are definitely outshining them. It's just shocking.
Yeah. So what are some of the other things about herbs that, have become your treatment of choice? I mean, of course, they have these nice antimicrobial effects. And again, we've now got some data between Dr. Shopi's work, Dr. Zhang's work at Johns Hopkins. But what are some of the other things about herbs that you prefer for your patients?
Well, I love that you get side benefits instead of side effects. Like, for instance, when we're addressing microbes, there's this long, ongoing battle between is an infection due to the microbe or is it due to the terrain? Like, for instance, is it the fact that your immune system is not resilient, that you have issues? And what I love about herbs is they address, well, certain herbs will address both. So, for instance, when you're using like the cemento, when you're using hatunia, when you're using Chinese skullcap and other herbs like that, they're modulating the immune response, balancing the immune response at the same time. So they're lowering things like NF kappa beta, which is like a mother cytokine that then creates this effect where all the other cytokines elevate, causing inflammation in the brain and the body. And so with these herbs, you're getting benefits on that. They've also been tested, some of these herbs, head to head with prescription anti-inflammatory drugs and shown equal efficacy. And in one case, Takuna, double the effect, double the anti-inflammatory benefit. And so you're getting these side effects where you're killing infections, but you're also supporting the immune response and inflammation in the body all at the same time.
Yeah, I think that's really one of the big advantages of herbs. The fact that, if you look at, generally antibiotics, it's one chemical with one desired goal. With herbs, multiple constituents in plants that do multiple things. So this ability really to tailor the treatment to the individual depending on the kind of symptoms they have. If someone's having more arthritis, we might want son of herbs. If they're having more cognitive impairment or brain fog, we might want a different set. So we can really truly mix and match to find the right combination. And the idea that herbs work very synergistically. Again, we see this consistently. And I look at like traditional Chinese medicine where you never give a single herb, or even in Ayurvedic medicine. These systems of medicine have been around for thousands of years, and it's really about the combination of plants put together to achieve the goal that you're wanting.
And it's so nice to be able to put them all in the same cup and just drink something twice a day rather than having to, or maybe three times a day, depending on your regimen, than having to take so many pills. We all have pill fatigue if we've treated these like chronic illnesses, the other thing is that with Lyme, it's never just Lyme, as you know, right? It's never just Lyme. It's Lyme plus Bartonella or Babesia or
Yeah.
Mycoplasma or viruses, whatever. And then even the studies that have come out showing that the ticks now have been shown to carry filarial nematodes, which are worms, right? So the beautiful thing about the herbs is that they kill parasites, they kill worms, some of them, if you choose the ones that do. And then also, when you look at T cell testing of patients with chronic Lyme, they have been shown to have chronic viruses underlying that are creating that immune response that's allowing the Lyme to just sit there and not be eradicated. And so these herbs are also antiviral, and that is helping as well. So the herbs are going to be addressing these other microbes behind the scenes that we may not even be aware that, the patient is suffering from.
Yeah, and I look at herbs like cat's claw and like artemisia that again have shown to be immune modulators. They use these things for like rheumatoid arthritis and other non, tick-borne related illnesses. So, I mean, it's such a big plus in again trying to fix a disrupted immune system because we know that Lyme and a lot of these co-infections can do that. I think a lot of these people who get chronic tick-borne illness probably already had some other underlying immune dysfunction, which led to where they're at. So again, anything we can do to kind of get the immune system back online and do the job we want it to do is going to be a huge plus.
Yeah, and I love to be cost efficient. And so if you can combine products that do many things, then the patient gets to be on less products. And, I say that, but when patients come in as sick as they are, they end up on a lot of things initially. And that's just
Yeah.
the way it has to be. But what we try to do is wean them down when they're better to the least amount of products as quickly as we can. And so if they have multi improvements with multi systems, you're
Yeah.
going to get less products faster, and that's the goal.
Yeah. Well, you and I use a lot of NutraMedix products, a lot what we're talking about, like Banderol, Kumanda. Some of these plants are very unique to NutraMedix. As I understand, they're able to export a lot of these plants out of Peru that other companies aren't able to have access to. And I've just appreciated them so much because they're clinically effective. The fact they said they're liquids for people who have pill fatigue. It's you can drink it versus having to take more pills, and you can literally use drop doses for people. And I guess I've been doing it long enough. I shouldn't be surprised anymore how sometimes just a handful of drops, sometimes even one drop twice a day for people, moves the needle in the right direction.
Yeah, they're really powerful. And what's interesting is NutraMedix has a way, first of all, they take them from the Peruvian rainforest in a way that's sustainable. I think that's important for people to know. And they have a great relationship with the indigenous people and the locals there. And I think that's important as to why they have access to these herbs. And they then have them in their own possession, and they have a trademarked way of getting more herb basically into the blend. And so I think that the efficacy is higher. I'm seeing just more potency, more improvement. Certain herbs for certain conditions. I mean, like you said, one drop will knock their socks off. And thank God for the Burbur-Pinella because
Yeah.
it works amazing for any Herxheimer reaction. I mean, nothing compares. And so we can, if we overshoot a little bit, we can get them back out six dropperfuls over an hour, and then get them back out of that, and then lower the dose and go a little slower.
So, can you talk a little bit about maybe I mean, again, everyone's different. I don't want to suggest that, there's a one size fits all, but I know you and I both have our favorites.
Yeah.
And, when it comes to like, we'll just take acute Lyme disease, minus co-infections, because I don't want to make this complicated, but what might be some of your go-tos with NutraMedix for someone who's got acute Lyme? And
Yeah.
I'll preface this by saying, look, this might be a time where antibiotics would be appropriate, and it is possible, like you said, to use antibiotics and herbs. But I have used herbs exclusively for acute Lyme disease. I've seen great results. I don't feel like I personally need to give people antibiotics to be successful in dealing with acute Lyme.
The
But
only time I would use an antibiotic is if I'm worried about standard of care for medical legal reasons. And
yeah,
the good news is that standard of care came from the IDSA, and they really minimally recognize that this is an illness and minimally use treatment. So you're not really bound to using it very long. So their guidelines are very short term. Like I think they even have a 1 day doxy now for just acute Lyme. So you give
yeah,
them one dose and you're done. Now you can move on and actually treat with the herbs, and you did standard of care. Now, if you've got neuroborreliosis or it's cardiac, you have to treat 14 to 20 days. And even that is silly, ridiculously slow or
yeah.
low amount of time to be treating, low duration. But that's good because it gets you off the hook 14 days and you can just pull it back out of the regimen and you met standard of care. And I think that's important for those who have medical licenses that need to follow that. But I would never use doxycycline without Cemento. Cemento, by the way, is a pentacyclic cat's claw, and that's really important when you look at clinical trials for anything autoimmune related, even the human double-blind study for rheumatoid arthritis. Look at the title. It says the pentacyclic chemotype of cat's claw because the other ones are immune stimulating, and we don't want to do that. So, an immune modulating Cemento in conjunction with doxycycline will make sure we're addressing round bodies as well as addressing the immune response along with the doxycycline. So that is one thing I like to do. But I do prefer the herbs. So for standard Lyme, it's Cemento and Banderol, and make sure you have stevia on board for at least 2 months before weaning treatment, so you don't have any recurrence from stationary phase that's been unaddressed or biofilm. But it's never just Lyme, right? So when I say that, if I'm treating Lyme, I'm always using Cemento, and what I'm pairing with it depends on the co-infections. So I can pair it with lots of other herbs that cover the other co-infections at the same time, and that's what I like to do.
So, are you in the camp of going in with a high dose of the herbs for acute Lyme? What would be like a general recommendation? We'll say for an adult. Obviously, we would adjust it for children.
Yeah, so I don't treat a lot of acute Lyme. Everyone I see is chronic, right? They come in with neurological symptoms. That's crossed the border, even if it's been a recent. In fact, I had a little girl who went to the park and doesn't even recall a tick bite because remember, only 17% of people will recall a tick bite,
Right.
right? And more than half of them will have negative labs. But this girl ended up, her knee blew up the size of a volleyball for no known reason. She went to the ER, and the doctor at the ER, believe it or not, had a friend who was a missionary in Africa and said, "This is Lyme," and gave her doxycycline, unheard of. And it went away immediately, but he only gave her 7 days. And
Mm.
so the mother called me. I brought her in. I gave her another course of doxy because to me, this is acute Lyme. And so back then, I was using doxy. And I would do 30 days of doxy for acute Lyme. That was what I did back in the day. And it got better, and then she stopped it, and it blew up again. But this time, joint pain, neurological, all the symptoms. And I thought, wow, this woman got treatment within 1 day. This girl, this little girl, with the correct antibiotic, and still ended up with chronic Lyme, right?
Yeah.
So then I put her on the Cemento Banderol combination, and her symptoms went away immediately. And we treated her somewhere between 6 and 12 months, I don't remember, before stopping herbs. And then she was fine after that. But every time she tried the doxy and stopped, it came back. And we know why now. We have the clinical studies to show it's not eradicating it, but the herbs do. So now for like acute Lyme, do the doxy for your license if you have to, the amount of time we talked about earlier. But Cemento plus Banderol, and then finish it off the last 2 months with some stevia if there is a last 2 months. If you caught it and they get better fast, you may not even need the stevia. Cemento plus Banderol will eradicate it. And usually what I'll do is use like a combo, like NutraMedix has NutraBRL as Cemento Banderol Stevia.
Yeah.
That's fine, or just pick Cemento and Banderol separately. And I love the homeopathic Ledum palustra. That one is really good for bites and from getting infections like Lyme from bites. And so if they have access to that right away, I'll have them take that like 5 doses a day for the first day, and then just wean that down over the first month, and do that in conjunction with the herbs. And so that's optional; they don't have to do that. So in other words, I don't have a set. Everyone does it the same way. But doxycycline, perhaps, definitely the herbs always. But as a caveat, I said Cemento and Banderol, but I'll tell you a story. Is I had this little girl who got a tick bite, a known tick bite, and the mother asked for treatment, prophylaxis for the tick bite. And I said, well, she needs Cemento and Banderol and maybe Ledum palustra. She was not sick. We didn't use doxycycline. That child, 6 months later, was brought to me with anger and rage and homicidal behavior. And I thought, oh, for God's sake, she's got Bartonella. It never occurred to me because, if somebody's not sick and you're doing prophylactic treatment,
Right.
the last thing you want to do is make them buy so much stuff. And you don't know if they need it, right? They're not sick. Well, now I cover for Bartonella after seeing that case. It was horrifying. She was trying to murder her siblings. So, what I do is Cemento plus BRT, the Nutra BRT, because that will have the Kumanda, which partners well with Cemento for Lyme. So you're covering Lyme with that. And then it pairs with Petunia, which is great for Bartonella. So now I'm covering that. And now I'm liking to add the Chinese skull cap because it adds coverage for Babesia, which is really common in the ticks. So now I'm sort of like asking people, like, how aggressive do you want to be? How many bugs do you want to cover? And using more of that approach where I'm using these combination herbs to cover more things when they get tick bites. And the illnesses are real, they're common, it's not rare. And so it's just the art of not wasting people's money more so than you need to, and yet making sure you cover as many things as you can.
Yeah, and I agree. And again, I use a lot of Cemento, a lot of Banderol. I use Kumanda routinely.
Yeah.
Cemento, Banderol, Kumanda are my trifecta for acute Lyme disease. I'll still usually add Burbur-Pinella in anyway, just to help support detox pathways. Again, it's not going to harm anybody. And I've used that a lot. And again, I've been using more Chinese skull cap. I like the anti-inflammatory effects of Chinese skull cap. And again, it does cover a little broader base. Again, sometimes we just don't know what you've been exposed to. And again, even with the best of testing out there, nothing's perfect. So if we want to really just edge on the side of, hey, let's cover the broadest base possible, then between all those plants, we pretty much cover Lyme, Bartonella, and Babesia.
That's exactly what I'm doing. And I will say that I spoke to a doctor once, this is funny, who treats a lot of complex chronic illness and Lyme. And she told me what she's doing. She's dosing the Burbur-Pinella a lot higher than I am. She's putting 2 full droppers in the cup twice a day with each of their herbs that they're taking, and then has them take 6 dropperfuls in their water bottle during the day. Now that's how I dose someone who's in a Herxheimer reaction. She
Yeah.
doses everyone that dose every day, which by the way would be expensive. You'd be going through a lot of bottles. But
Yeah.
she told me she has never had another patient have a Herxheimer reaction ever since she started doing that. Really complex patients. So, for people out there that are frustrated and struggling, that's the dosing to try. I wouldn't recommend that for everyone. I think it might be wasteful financially. But if you dose it high enough, what you're doing is you're mobilizing the lymphatics and the glymphatics to get things out of the brain. And the Pinella portion even has studies showing that it raises the seizure threshold, so you don't have as many seizures. It's neuroprotective. It helps the liver, the kidney, the colon. So you're getting one-stop support with the Burbur-Pinella, and it really, really works for the Herxheimer. So.
So, for the majority of our patients, again, who are coming in with chronic persistent Lyme disease, is there a different approach or is there a different set of plants you might consider?
For chronic, for chronic, I'm using the same cemento banderol, but I'm using more herbs. I'm covering more co-infections. Cryptolepis, we didn't talk about yet. Cryptolepis has been shown since 2020 in all three of the major co-infections, the Borrelias, Bartonellas, Babesias, right? To eradicate all of them, and even the persister stationary form of the Bartonella and the Borrelia. And has great IC50 data for Babesia. And so I love cryptolepis. The problem with cryptolepis, and I'd love to hear your opinion on it, is there's one study out there that says that it may impair fertility and it may be cytotoxic. So it gives me pause. And because I was treating Lyme for more than 10 years before
Yeah.
those studies came out, cryptolepis was not necessarily necessary for my practice. Like I was doing well without it for Lyme. But my success rate for Bartonella was not great. So I am adding it to Bartonella
Yeah.
before I stop treatment. And then for Babesia, the IC50 data shows it's the best herb for Babesia, along with Artemisia annua and Chinese skullcap as the close second and third. So I'm using it for that. For Lyme, I'm just sort of only using it if they're not getting better. But most people have one of these other co-infections, so cryptolepis becomes part of the mix. What do you think about that one study? Do we need to be concerned? What do you think?
Yeah, again, I'm always very wary when I hear about the one study on a plant being toxic, dangerous. To date, I have not seen any convincing data on any of the plants that we use to treat Lyme disease. And again, I treat a lot of women who are pregnant at various points of their pregnancy. I treat women who are breastfeeding. I have personally never seen a problem during pregnancy or during breastfeeding. And it's again, our caveat is like, look, they don't study these in pregnant or breastfeeding women. There's very little data out there, if any. But again, if you look at the toxicity studies on these plants, the amount you have to give is so astronomically high to actually cause a problem. People just in the recommended doses, you're not even remotely close. I hear this about cat's claw all the time. There's, again, a couple of in vitro, or I should say, animal studies, rat studies that suggest that maybe it causes fertility issues, spontaneous abortion. And again, I think it's a misleading kind of data, considering the things that they give pregnant and breastfeeding women conventionally. If women get a UTI, no problem giving you antibiotics. If you get bronchitis or pneumonia, no problem giving you tons of antibiotics, steroids, lots of other things. And, as far as we can tell, most of these things don't leave any kind of detrimental adverse effect during pregnancy, delivery, or so forth. So if, conventional medicine's so happy, not happy, but so willing to give pregnant women these things that are going to be way more toxic potentially than a plant,
Yeah.
I'm much more confident in using a plant that's been used for centuries, has a long track record of clinical use. And again, when you look at indigenous populations that have been using these plants to treat various things over the years, we just don't see any adverse effects. I mean, we would all love there to be more research and studies that prove
Yeah.
this conclusively, which the reality is there just isn't enough money
Mhm.
to study these things. But I think it's logical that there are some plants that are truly toxic. If you give somebody belladonna at
Right.
high doses, you will make them very sick. Absolutely. Give them a ton of digitalis. Yes, they will have a problem. But again, in general, we don't use these plants in clinical medicine. And if we do, very, very low doses under very close supervision. But, so far, all the plants I've ever used for any tick-borne illness, again, when I dig into the data, I've never seen certainly a convincing study. And I understand why practitioners want to be very cautious. We all want to do. We certainly don't want to cause any harm to patients and certainly to a mom during pregnancy. But I worry that there is data that shows that there's vertical transmission, that mom, if she's got Lyme disease or Bartonella, can pass it to her baby. I think that's far more detrimental than, what the impact of a generally regarded as safe herb is going to do.
So Charles Ray Jones said that it's a 50-50 shot if you have a pregnant woman with Lyme that she's going to pass it to her child with no treatment. If you give one antibiotic, it drops it to 25% odds of passing it on. And if you use two antibiotics together, it drops it to 2%. So the standard that they're doing is like amoxicillin plus azithromycin. So that, what that does to the gut microbiome and what that can do, we're talking about, what does acetaminophen or Tylenol do to the autism risk right now? Well, what do you think antibiotics do to the microbiome, to the autism risk? Dr. Shaw, who did that acetaminophen study years ago, also studied that. And so I think you hit the nail on the head is that if these herbs are safe, it's a way better shot. So my question for you is, are there any herbs that you would not use in pregnancy for Lyme? Like for instance, Artemisia or Cryptolepis. Those are the two I shy away from. Um,
I've used them both, and again,
and
I've never seen a problem. I think Artemisia gets a little bit of a bad rap because people have used artemisinin, which is one
Correct.
specific component of Artemisia, and there are studies showing that artemisinin can be toxic to the liver. However, there's no evidence that whole plant Artemisia causes these kind of problems. So, again, I think this is where when we start tinkering with Mother Nature and we try to isolate the quote active constituent of a plant, we're really missing the forest through the trees here. That we're getting so hyper focused on that one thing we think does all the work. Where again, all these constituents in the plant, I mean, nature has a wisdom. They're designed to work together. So, in using whole plant Artemisia, I've never seen liver problems. I've never seen any kind of really serious adverse effects. I mean, as a whole, when we talk about any kind of adverse effect from the herbs we use, and certainly from NutraMedix, maybe a little GI issue once in a blue moon. But consider that plants are food and they get absorbed at the first part of your small intestine, like your food does. So very little of these plants actually make their way down to the large intestine where most of your bacteria live. So
Right.
unlike antibiotics that are going to have a threshold of absorption, and some of that antibiotic gets down to the lower GI tract that causes a disruption in your microbiome. Again, plants as a whole rarely do that.
Excellent. Yep.
Yeah. So, in terms of treating children, can you just talk a little bit about treating children versus adults? Any precautions or things that maybe parents should be careful or considering if they're going to be treating their kids with herbs?
Yeah. So, first of all, I think they're way safer than drugs. I think that more than cautions for parents would be giving parents some comfort in that sometimes parents are concerned about alcohol in tinctures for their children. And the one thing about the herbs that I'm using from NutraMedix is that the alcohol content is 21 to 24%, which is much lower than most herbs, tend to be
Yeah.
60%. That I guess I carry herbs from other companies for a
Yeah.
variety of things. And if you were to take two full adult doses of one of these herbs from NutraMedix, the alcohol content you would get is the same as eating a ripe banana. And so it's not much. And then if you were still concerned about that, you can just let that herb sit in the water or the juice or whatever you're using and let it evaporate out over an hour before giving it to your child. So that is a concern that I've heard that it can be alleviated. But as far as other issues, no, it's not taste issues. The only taste issue I hear about is stevia because it's too sweet. And we don't have to use that till the end, and we can maybe mask that in a smoothie or whatever you have to do. But the other herbs, they're not an issue. They can be put in anything other than something hot that would denature it. So it's better in water if they'll take it, but you can put in anything. And I'm not particular. Some practitioners are very particular, like 30 minutes before a meal, blah blah blah. I find that if you get these herbs in twice a day, you get better. So I don't really care when you take it. I don't really care what you take it with. I don't care what you put it in. Put them all in together because you're going to get better. And maybe it's 5% less efficacious than if you did it a real strict way. And some patients want that. They're very
Yeah.
particular, and that's great that you can do that. But most of my patients like just get it in the child and get the child well, and let's make it easy. And you
Yeah, I yeah,
can.
I completely agree. I mean, my experience is that it doesn't matter if it's with or without food. I know
Yeah.
the recommendations usually to give it before you eat, but just for practicality and timing,
Yes.
kids rushing to get out of school in the morning, we just got to get it in. I have really not seen any significant difference in when people give it. And again, I think that's again the beauty of plants being food, essentially, the way our body metabolizes it, processes it. It kind of doesn't matter if it's with or without food. So I like the flexibility of timing, of how you give it. It really makes it easy for people. Sometimes when people get to the higher doses and they're counting out drops, they get kind of annoyed. But I'm like, dude, it's 60 seconds to count out drops. It's really not that long, and to do it twice a day. And plus, I like the fact again, there's usually, I mean, I don't generally dose 3 times a day. Maybe occasionally for acute Lyme, but most of the cases it's twice a day. So just thinking that middle of the day is when most people forget to take their stuff anyway. So it does make it a little bit more easy just to do the twice a day dosing.
How are you treating acute Lyme?
So again, Cemento, Banderol, Kumanda, Burbur-Pinella are kind of my go-tos. If I'm suspicious just based on symptoms before we get any kind of testing back, again, I may add Chinese skullcap,
Yep.
Petunia, or Artemisia in, just depending
Yep.
on the symptoms, to cover a broad base until proven otherwise.
Agreed.
And again, it might be a bit more expensive in the interim, but my feeling is the cost of having chronic Lyme is way worse. Uh,
100%.
so if you
100%.
spend a little bit more money up front for 2 months to save yourself 12 to 18 months of long-term treatment, it's a worthy investment.
Yeah, and the one caveat also is always check for mold, right? I've got patients that spend months and months on treatment and then they're not getting better. If you're not getting better in a couple months with these herbs, look for mold because if you have mold, it's suppressing your immune system. And if we can address that early, we can get you better so much quicker. And it's not as stressful as you think. It doesn't mean you have to tear your house down. Check your house. Sometimes it's a simple little thing. It's not always you hear the horror stories and you're afraid to check your house. Check your house, do it right. Use envirobiomics.com, use immunolytics.com. Don't call the mold guy from the air, that's going to measure the air. Just test.
Yeah,
Right.
absolutely.
Yeah.
Before we close out here, any parting thoughts on Lyme treatment, NutraMedix herbs?
I just think that when I hear the one thing that I want to say is when I hear people say, "Oh, I tried herbs and they don't work." It's like they're treating all herbs as if they're the same, right? Oh, I tried herbs, that route didn't work. And these herbs are not the same. It's like saying, oh, I tried amoxicillin, but you had like a parasite. Well, you didn't try the right antibiotic or the right
Right.
antimicrobial, and it's the same. And I just think that it's really important to do that. And the most important thing for me as a practitioner is that, I mean, I know who the healer is. It's my God. And I think that, having wisdom, through prayer as we choose modalities is most important, not to just jump from every little thing, but to just prayerfully consider what do I want to do? What's going to be best for me or my child? And then proceeding through a path of peace into that path.
Absolutely. Well, I appreciate you spending time. It's always great talking with you. It's always nice to have a like-minded colleague who's in the same camp. And I know we approach people with the same perspective, and we've seen just wonderful clinical results for people with minimal side effects. And ultimately, that's our goal, right? Is we want to help heal people in the least invasive, most effective ways. And again, the NutraMedix and the herbs have been really a big part of my and I know your clinical practice. So thank you for sharing all of your wisdom with us today.
I got some out of you too. I appreciate that.
All right, thank you so much.